Why does basal cell carcinoma recur after treatment? Imagine having a skin cancer that seems to disappear only to come back later. That's what happens with basal cell carcinoma, the most common type of skin cancer. Even after treatment, some cases return, and understanding why is key to better prevention and care. Basal cell carcinoma develops in the basal cells, which are found at the bottom of the outermost layer of skin. It's mainly caused by long-term exposure to ultraviolet radiation from the sun or tanning beds. While it rarely spreads to other parts of the body, it can grow locally and cause problems if not completely removed. Recurrence happens for several reasons. The most common is incomplete removal of the cancer during treatment. Sometimes, the edges of the tumor are not fully cleared, leaving behind tiny cancer cells that can grow back. Techniques like standard surgical excision may have higher chances of leaving behind some cells compared to Mohs micrographic surgery, which involves removing the cancer layer by layer and examining each layer under a microscope until no cancer cells remain. Certain tumor features also increase the risk of recurrence. Larger tumors, those that invade deeper into the skin, or those with aggressive growth patterns are more likely to come back. Tumors located on the face, especially around the nose, eyes, and ears, are more difficult to remove completely because of the complex anatomy. People who have had basal cell carcinoma before are at higher risk of developing it again. This is partly due to cumulative sun damage and genetic factors that make some individuals more prone to skin cancer. Additionally, people with weakened immune systems, such as organ transplant recipients, have a higher chance of recurrence because their bodies are less able to control abnormal cell growth. Continued exposure to ultraviolet radiation after treatment also plays a significant role. Sun damage causes new mutations in skin cells, increasing the chance of both recurrence and new skin cancers. Genetic predisposition can further elevate the risk, especially in individuals with inherited conditions that make them more susceptible to skin cancers. To reduce the chances of basal cell carcinoma coming back, regular follow-up with a dermatologist is essential. Skin checks help catch any signs of recurrence early. Protecting the skin from ultraviolet rays by using broad-spectrum sunscreen, wearing protective clothing, and avoiding peak sun hours is equally important. Maintaining a healthy lifestyle supports overall skin health and immune function. For high-risk or difficult cases, specialized treatments like Mohs surgery are often recommended because they have lower recurrence rates. From a broader perspective, most basal cell carcinomas are treatable when caught early. The goal is to prevent recurrence by combining good sun protection, regular skin monitoring, and prompt medical attention for any suspicious skin changes. Always consult a healthcare professional for personalized advice and treatment options. In summary, recurrence of basal cell carcinoma mainly results from incomplete removal, aggressive tumor features, prior skin cancer history, ongoing ultraviolet exposure, and genetic factors. Choosing the right treatment method, such as Mohs surgery for high-risk cases, and practicing diligent sun safety can significantly lower the chance of the cancer returning. Remember, staying vigilant and working closely with your healthcare team helps keep your skin healthy and cancer-free.